Hello and welcome to episode 327 of the Untethered Podcast. I am your host, Hallie Bulkin, and today I am so excited to be here welcoming somebody who's not only a dear friend, but also one of the most brilliant, passionate, and forward-thinking minds in holistic dentistry. And that, my friends, is Dr. Jennifer Tipograph. Jen is a proud native of Washington, D.C., and her journey into dentistry is both inspiring and deeply intentional. After earning her Bachelor of Science from Virginia Tech, she began working under the mentorship of Dr. Kimberly Barrett, Natural Dentist Associates. That's where her love for holistic dentistry and her commitment to treating the body as an integrated whole was born. She then went on to graduate school and graduated third in her class, first female in that spot, from Howard University College of Dentistry. Since then, she's become a certified provider with the International Academy of Oral Medicine and Toxicology, trained in the safe mercury amalgam removal technique, and skilled in advanced growth appliances like the DNA, Liao, and ALF, as well as holistic implantology using metal-free zirconia and regenerative techniques like PRF. Dr. T doesn't just keep up with dentistry, though. She elevates it. Through hands-on experience, ongoing education, and a whole body approach to care, she is transforming the way patients experience dental health. As for me, you guys know me. It's a shared episode, so I'm not going to spend too much time talking about myself, but I'm an SLP, a speech language pathologist by trade, business mentor, feeding therapist, myofunctional therapist, and founder of several programs like Feed the Peds, a certified pediatric feeding therapist certification, the Myo Method, the Myo membership, the CMT certification for myofunctional therapists, to help assess and treat orofacial myofunctional disorders. So all things feeding and myo. And I basically help SLPs, OTs, PTs, dentists, dental hygienists become confident in either the pediatric feeding and or myotherapy spaces while mentoring clinicians in building online businesses as well. So together, Jen and I actually wrote a series of books, of kids' books. We've swapped some big ideas, and today we are bringing our shared passion for integrative care straight to you. Let's dive in. Welcome to the Untethered Podcast. I am your host, Hallie Bulkin. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and or medical treatment of a qualified healthcare provider. Hey, Jen, welcome to the podcast.
Hi.
How are ya?
I'm good. How are you?
I am good. So for everyone who does not know Dr. Jennifer Tipograph, she's a dear friend and colleague of mine, and she has been on the podcast. I think you were like episode number 4 or something. Yep. Is that right?
Way back when.
Yes, back in 2019 when I started all of this. And since then, we've done a few things. So before we jump into that, give us a little bit of a background about like who you are and what you do, and then we'll dive in.
Sure. Yeah. Thank you so much for having me. I'm happy to be back. So I started off actually as a dental assistant before I went to dental school at the practice that I'm currently at, holistic dental practice, and then went to dental school, came back, started working as a holistic dental, like after being a dental assistant, working as a dentist at the same dental practice. I went and got training with the IAOMT, which is the International Academy of Oral Medicine and Toxicology. Super passionate about all things holistic. I'm a holistic mom. I practice what I preach. But in terms of, the practice, we take into account the mouth is connected to the rest of the body, which is super important. So that addresses certain dental materials, airway. You come in, we're talking to you about your supplements, your sleep, all of it. So it's very cool. I love it. I'm very into it.
I love it too. That's why, that's why we get along so well. And you guys all know me, so I won't give like a whole background on myself, but SLP, feeding therapist, myotherapist, definitely in the airway health space, very holistic as well. And yeah, Jen and I have known each other. It's really funny because like our daughters, we were talking about this. we met when we were in first grade, and we now have, or not, was it first grade, second grade? Second grade. Yep. Second grade. And we now have daughters going into second grade, which is absolutely wild. But today we're going to share like the what, the why, the how behind these little books sitting here behind me, our children's book series on tongue ties, myofunctional therapy, and frenectomy. And so, let's jump right on into that, because I know a lot of people have been asking us, what inspired you guys to like create this series? So I don't know if you want to start, Jen, but
it was very cool. I went in as the mystery reader for Gabby's class, and it was the first time they'd had a mystery reader that was also the author, which was very cool. But they were being taught how to write and how to illustrate. So that's also where some of these questions came up, like, well, how'd you do it? What did you do? Blah, blah, blah. So you and I started writing them probably at this point, because Mo's turning 5 this weekend. So probably like 5.5, 6 years ago, you and I would meet in like these coffee shops, basically in Bethesda, that I don't even think they exist anymore, honestly. And we would just start writing because you and I thought that there was a need for this. I mean, there was nothing out there to talk to parents, to kids, and, just kind of bring it down to a level that people understood. So you and I started writing, and then you moved to Florida, and then we would, meet virtually and, just start adding and editing. And then we hired the illustrator, and the rest is history, basically. But it was a cool process. It took some time, but it's obviously worth it. We have this great product now.
Yes. Yeah. And I think, just to echo what you said, it was like there wasn't anything out there. Yeah. And I kind of like, in my brain, I was like, let's normalize this conversation, because there's so many kids, they don't really get it. Mm-hmm. They don't even understand that their tongue is stuck, or they don't understand that their tongue should be able to do other things. Like, you have adults who don't understand that, because that's just what they know. It's how they've lived their whole life. So I was like, if we can like bring this into like a fun little story and get kids like comfortable with the conversation and the topic, and then even introduce this concept to parents, like, how cool would that be? And now I feel like there's been other books that have come out, like related, not exactly the same as what we've done. But I'm like, if we could have like a section in the library, or the section at Barnes and Noble, or you go to Amazon, and there's like books, right, on these topics. Like, how cool?
Yeah. And I do think we're getting through, because we, like, the other day I went to this like play-based place with the kids, and we were playing like vet, for example. And Mo was like, Mommy, there's a guitar string under, this cat's tongue. And I was like, okay. But I was like, whoa, you got it. Like, you understand now. And it was very cool to see it actually translating, into understanding.
I love that. Yeah. I love that. I feel like after having worked because I was really working primarily with kids and some adults in the myo space, but primarily kids with like speech and feeding and then myo and everything, it was like the same thing. Like, it just wasn't clicking. Yeah. And, it was sort of like, how do we normalize this? So I would tell them like a little story, or we would make it really playful. Yeah. And, and I think that's when like you and I were like, wait, we need to write some kids books. I was like, yes. Life got in the way a few times. Yeah. It kind of got put on the back burner, but 5.5 years later, here we are.
Here we are. Yeah.
I love it.
And it's cool, because now like our kids are reading the books to us.
Yes. Yeah. Isn't that wild? That is so cool. Funny. I was running a call for my feeding course last night, and it's the TOTS module week. And so we were talking about tongue tie, and this question came up, and it's funny because I didn't even think like, have them read these books, but like, hi, I'm going to go back and tell them that now. But someone was like, how do you prep a kid for a frenectomy? Like, how do you prep them to do that active wound care and the exercises afterwards, And I just started giving the whole laundry list of things. I was like, you've got to make it playful. You've got to normalize the conversation. Talk about it before. Make sure that they're used to it before they go for the procedure, so that it's not something new after. Yeah. Like, do it in a mirror. Maybe let them hold the phone. They're going to want to see what's going on, because it's like you're going in their mouth, and that can be scary, right? But also let them do it on you while you then, it's like everybody take turns, So I'm like, to have like these books as tools in addition to all these other things we can do, I'm like, it just makes things easier.
I mean, you and I both know that it makes the treatment that much more effective.
Totally.
I mean,
yes.
So,
yeah. And like, I want kids to understand like their bodies. Yeah, I want them to understand, like, this is your tongue. Your tongue, it connects here and here and here and here, all the way down to our toes.
This is connected to the rest of the body. That's what I mean, we talk about all day with people, like upper jaw with the eyes, the lower jaw with everything else, and people will come in and I think, it's like we co-treat 3 times a week with a PT. We, we value the importance of the body work and the input we get from these PTs, because one's like an osteopathic PT, the other one utilizes like counter strain and postural restoration, and like all these different modalities that they're using to help assess the patients. And it's such valuable feedback to see how everything's connected. I mean, and people do appreciate it. They're like, whoa, how did you know my left shoulder was tight? And it's like, okay,
Yeah.
Yeah.
Yeah, I know. I was treated by one of them, and he would go down and like he'd like pinpoint something. He'd go to my head, right?
Yep.
And like the brain mapping, and then he'd go down to my leg, and he'd be like, "Do you feel that?" I'm like, "Ow!" I'm like, "How did you know to go right there? Like you go 2 like millimeters to the left, and it doesn't like I can't feel it, but he goes in that one spot." And I was like, "That is wild. It is so very cool to like see how it is again also interconnected."
Yeah.
So is there anything that you wish like parents or even children would know before like they see you in the dental chair? Because I feel like you have a very different kind of holistic approach in office. So you guys are obviously looking at everything when someone comes in there, just coming for a cleaning and sitting in your chair.
Yeah. Well, I mean, I feel like a lot of people do come in educated nowadays because of, social media or online, or people are, people are educating themselves. They're coming in more aware than they did probably some years ago. But there are some people that are still learning. I mean, look, we're all learning, we're all growing, So some people will come in, and no matter if you come in knowing a lot or a little, I talk to the patients. I sit them down. I say, okay, like, give me a little bit of why you're here. We discuss that. And then I start going through like their medical history, their dental history. We spend a while going through that because it allows me to understand the full picture. So while I wish maybe there were a few things they would come in with more, I feel like it's hard to say because people do come in pretty educated, but if they don't, it allows me the opportunity to educate, which is nice. Like there's little things like I talk to people about because, anytime you eat or drink anything that's not plain water, it can change the pH in the mouth. So like, it's great. Our kids snack on an apple. I talk to people about like nuts, carrots, like raw foods, the chewing aspect of things. Like you and I've talked about like pouches versus real food, and look, time and a place for everything. But like, it's important that people understand, like, for example, their child goes, or they even go to eat an apple, it's still sugar. Take the water you're drinking and just switch it around and swallow, just like little things. But, those things can add up. So, I do appreciate, and I do appreciate when people come in, but at the, knowing stuff, but at the same time, like, I love what I do, and I'm happy to like sit there and talk all day about, certain things we can improve on. And, it's also knowing, how much and how little, and, because some people would want to just do step by step, and that's fine too. But treating, the whole person is just, it's very rewarding. It's great.
Yeah. Yeah. No, it's always very interesting too. Like when I talk to my team and they're like, I was talking to this parent and I asked them about sleep, and they're like, well, why are you asking about sleep? My kid's here for like speech or for feeding. And they're like, cause it's all interconnected. And when you start to like talk about the nervous system and how that's impacted by how we're breathing, how we're sleeping, how we're chewing, how we swallow, like all the things, it's sort of like parents kind of like this like light bulb goes off and they're like, oh, well, no one's really ever like, talked to me about that before. Yeah. But to that same token, like the practice is getting more people who come to us because they know what we do. They know like we're more holistic. Right. They're like, okay, I've heard you helped this kid, or I know that you guys look at these things like, and we're like, yeah, amazing, right? Not every parent. There's still a lot of educating that we do, but but we're also not a holistic dental office. Right. So a little different. But no, I think it's really cool though, that I do feel like there is education happening, because that was like one of my big dreams, like 6-7 years ago. I was like, if we could just like make this conversation more mainstream. And at that point, I feel like we're at least 10 years away from that. But I feel like I've seen a little shift where people are sourcing their own information, doing their own research. Like there's obviously so much to like sift through out there, and even knowing who to listen to and what to believe and all that. But I think a lot of parents are very intuitive, especially when they're in the holistic space. Yeah. And so it's very cool to see it like kind of coming. Yeah.
And I feel like you probably see it with your people that are coming to you. Like most people, like we see they're open-minded, like they're open to learning, to making change, and I get it. Like sometimes it's not the right timing if you're not open to making it, but it's just all about like providing people with the tools so they can function well and they can thrive. And it's a beautiful thing.
It is. Yeah. All right. So let's talk about the books.
Yes.
So let me grab this one. We got
Sure.
my tongue. Oh my goodness. My tongue is stuck. So in a nutshell, this one's about like a child who starts to notice that their tongue is just different, right?
Yeah.
It's not functioning the way, and they won't say that it's not functioning like
Sure.
the way it should, but they're basically like, my tongue is stuck, right? And so I think that kind of lends well to the conversation about like certain symptoms, like, you know, sleeping with your mouth open, maybe having trouble producing speech sounds because the tongue can't actually hit the articulation targets well, picky eating because the tongue can't move the food around or help you like create that ball of food that's ready to swallow the bolus. You know, but it's like we take a lot of this and without like even really talking so deeply about all those symptoms, like we just kind of make this kid-friendly story where it's like, hey, the tongue is not working. Oh, but we're going to go visit Dr. Teeth tomorrow for a dental cleaning. Let's go talk to Dr. Teeth.
And going back to what you said, it's allowing Nora in the book to become self-aware.
Yes.
And she is communicating in the book with her mom. So it's like getting the mom aware, you know, they're like talking, you know, during brushing teeth, which is also a good time for parents to talk to kids because you're already there. It's not sort of like, oh, bringing it up randomly, you know, it's like, oh, can you do that with your tongue, you know, and just slowly, just, you know, one step at a time, talking about it, exploring it, all those things that you had previously mentioned.
Yeah. And I know we worked like really hard to like get the images to like the point where it was like, I want the mom being like, hey, can you move your tongue over here? How about here? Can you go up, down, side, all around? Like, and you know, and she's like, I can't do that. Yeah. This is hard, you know, which I think is also very relatable because a lot of kids just kind of shut down if they can't do something initially, you know, they're kind of like, I don't want to do that.
Exactly.
Like, I don't like that. They're not going to be like, that's too hard for me. I don't like it. It's just like, no, I'm not doing that. So I think that whole like self-awareness that you mentioned is so important because I feel like kids are going to read this, right? And even some of like my kids are reading it and they're kind of going like, I can do that. And they're trying to like copy the book. And I'm like, becoming a little more self-aware about like what our tongue can and can't do. How cool is this?
Yes.
Yeah. So what do you think like, okay, so how do you think that we talk to kids or even parents, maybe if parents are listening or other providers, without like scaring them or making them feel like they're broken? Because like there's nothing wrong with them, right? It's just like different. Do you have any thoughts on that?
It's like we just want to help optimize function. We want to help optimize growth, optimize, you know, their speech, their swallowing, like you said, their sleep. So I think, you know, just gentle exploration, basically, you know, while they're brushing their teeth, or say you're like driving in the car and they're in the back seat with that open resting mouth posture, you know, like, hey, you know, can we play a game together? Let's, you know, try to, you know, like, this is probably a good segue into the next book about like the myofunctional therapy. Like, can you, you know, blow bubbles or, you know, put your tongue side to side, or can you show me how you breathe through your nose? Just make it fun. And that's what I've tried to do with like my own kids. Like one little thing that I do, and you can talk more on this, is like sometimes at like the end of the meal, if there's like just a little bit, not to say that they're like messy eaters, but if there's just like a little at the corner, say it's something, you know, they're eating or drinking, I'll be like, can you, you know, go like that just to kind of clean it up before I reach for the napkin or whatever, you know, and just trying to like make it basically so it's non-invasive.
Yeah, I love that. I mean, and I think that's a thing that we do though, right? Like we use our tongue as adults to clear our lips or to get like food off our face if it's reachable with our tongue. And I think a lot of kids, you know, nobody really knows outright that they're even doing it. It's so like reflexive or like second nature to us. And we're not going, oh, let me take my tongue and put it over there and try to clear that up. Okay, let's go. Right. No, it's like you just do it without thinking about it. But then people who physically can't because they're restricted, they don't do it. Right. So then they are wiping a lot more. They're not realizing that they're compensating. So I think you make like a really good point because again, it comes back to like that awareness of, you know, what we should be able to do. But then also, you know, with this whole like conversation around myo, just I think bringing awareness to the fact that like the tongue is supposed to live in a certain place. And, you know, we have the tongue trainer, as we call her in the story, the myofunctional therapist. And so it just kind of takes the whole idea of myo, and we have a fun little like poster that's seen throughout the story that has our little myo superpowers on it. Cause, you know, let's bring in a whole superpower theme here, superheroes. But it says like myo superpowers, tongue up, lips closed, teeth apart, breathe through your nose. And like, that's constantly what I would say to my own kids. That's what I say to the kids that I was working with as a myofunctional therapist. And it's establishing that closed mouth posture that's relaxed, that nasal breathing, the tongue living up on the roof of the mouth, and then, getting rid of any habits or, not so ideal patterns or, whatever might be present.
Sure.
So,
because the tongue is, it's a very powerful group of muscles, as you and your providers know, obviously, but it's like nature's retainer. If you can get it up to that roof, whether it's post-expansion or growth appliance therapy or braces or whatever it may be, I mean, that's amazing. And then a lot of times I tell people, like, if you can make these behavioral changes during the day, they can often translate into night. So like I do wear an appliance at night, but I wake up and my tongue is at the top, and which is amazing. But I will say about I just want to touch base about something, you have amazing providers that work for you. My son sees one of them. And I will say, I think going back to what we said about the parent, maybe the parents doing a little bit of the introduction of where the tongue is or what's going on, trying to get the child a little bit warm to the idea. But then if you have a great provider, they're going to take over from there. So I don't want the parents to feel so pressured, oh, you have to diagnose, you have to identify, you have to do all these things. It's sometimes you don't even really have to have the conversation. You could have the conversation with the provider, whether it's dental or myofunctional therapist. You don't necessarily need to have the conversation with your child, Yes. And I will say your specific provider that works with Mo, she makes things fun. He'll come home with whether it's a little game or when she was helping him to blow his nose, little things a sticker on the nose, just fun stuff that they don't even think of it as quote unquote therapy. They don't even think of it as work. They're oh yes, I get to see, Sam today, for example,
Yeah. Well, and I think that's what makes a great therapist too. Someone who's and I always say it's a dance between art and science. There's obviously the science behind what we're doing, but then there's the art of standing on your head when you work with children and keeping them entertained and making it fun. And if you're exhausted at the end of the day but those kids had fun and they did what you intended for them to do, you did your job and you did it well, And so I think that to your point, you got to make it fun. You got to empower the kids. You got to make the kids want to do it. If they're not interested, well, you're not going to get anything done,
Think we're adults.
It's so true. So true. When you make things clinical and scary and super serious, people are just okay, let's go through the motions, But when you're kind of laid back and you just and I think it's really important too, even in a young child, to connect it to something they care about, right? So if they like stickers, like you're saying, you put a sticker on the nose or a little post-it note or whatever, they like a superhero, you can print off a coloring sheet and be, and talk about their mouth. Yeah. Oh, look, your mouth is like Superman's or whatever. You know what I mean? It's
a chart, okay, they did their myo exercise, they get to color in the star. I mean, it's just, and also sometimes it's just a matter of depending on your child, making it make sense to them. When Mo started expansion, he was why do I have this thing? What's going on? And I said, your palate's like this. We want to make it like this. So he's oh, okay. And then now he'll ask me, is it still like this? I'm no, it's getting better, But sometimes the kids just, if you just simplify it, they make it make sense, So.
Exactly. And it's people get so hung up in things being so accurate or so pretty presented. Take a piece of Play-Doh and make a little model and be it looks like this and we want to like this. Just exactly what you were just talking about. And kids are just gonna be oh, okay. What do they have to compare it to?
Gabby just saw Lily and Mia's cases. Sorry, combined the two. Lily and Mia's. And she was wait, I want a case like that for my appliance. I'm sure, no problem. If it's a pink and purple case that gets her excited, by all means, you can have all the pink and purple cases.
Yes. So, ordering now.
Yeah, exactly.
Yes. So funny. I love that. Okay. So then to kind of transition us into the third book, let's get your tongue unstuck. Yes. Let's talk about and we kind of touched on this earlier, but the importance of a release and also preparing for that release. Yes. Just kind of to piggyback on this,
the timing of release,
how to make it not so scary. Yeah. Do you have any tips there?
Yeah. So I think, as long as they're working with a provider and they have the exercises on board before and after, that alone is setting you up for success. Because you don't want to do a release and there's no exercises on board. And then all of a sudden, I think you may have talked about, like, where is it going to go? You know, where is it going to live? Is it going to end up wanting to live in the floor versus the roof? I mean, you have to give the tongue the tools to be able to succeed. And I think by getting the myofunctional therapy on board before the release, the kid's already familiar with this. Yeah. So then they go in to do the release. And as long as you don't have someone making it scary for you, like, oh, you know, you're going to have to get a shot. Like, don't say that. Don't say, just, you know, sometimes less is more in terms of what you tell them, because look, a lot of people have dental anxiety. We see it all the time. You know, like when I had my own root canal tooth removed, I had some sedation. I totally get it. Don't get me wrong. But a lot of times, like if the kid senses like your fear, and it is normal, because my kids have gone through things, and I'm like secretly freaking out, but I'm like, okay, just stay calm, you know, stay calm for them. You know, they'll feel your calm energy, but at the same time, like, you also, if you want to prepare them, that makes sense too. So like, if you want to talk about like the shot, for example, you like the local anesthetic, you could say, okay, it's going to feel like a little like pinch or a little bug bite, or however you want to say it. And then we talked about in the book, like using the magic light, like that is a laser to release the tissues. And honestly, it's not a very long procedure. So, you know, especially like my kids were released pretty young. Like I think Gabby was 2 weeks old and Mo was 1 week old. They were both born with severe lip ties. In that case, since they were so young, it was like topical anesthetic, wipe it on, wipe it off, use the laser. And we were like in and out in probably like half an hour, like start to finish. Yeah. So it also depends on the age. That's a big, you know, because if they're a little older, you may want to prep them a little bit more and just use gentle language. I mean, what have you guys found with your therapists, and are they talking to them about the procedure or not so much?
Yeah. I mean, I think we try to understand like who the release provider is, you know, obviously we know your team, and just understanding like how things are going to happen. And I think it depends on the kid. Sure. Like some kids could walk in completely pretty much blind to just be like, you know what, we're going to go and they're going to use this thing and it's going to look like this pen kind of, but it'll be silver, and they're going to go and it's going to feel a little funny. They're going to make it so that your tongue can move. Yeah. And like, that's it. We don't say, oh, they're going to go cut the tissue. Or like, you know, like you can't say things like that to kids. Even talking about that with adults, sometimes you can see adults like tense up, right? And so like, obviously with an adult, like we'll have a like more straight up conversation when they're asking us questions. But we try to kind of like make it so it doesn't feel like such a mystery, but at the same time, it's like, let's also calm your nerves. Because like you said, like we want the parent to be calm, because the child's going to reflect whatever the parent's nervous system is doing. You don't want someone in fight or flight when they're coming in. Like you just want them to be relaxed. And, you know, I think also, you know, it also depends, like maybe, you know, some people are using a little bit of sedation, the nitrous or not. So in that case, like may not really need to tell them anything. And like you're saying, like, sometimes you do want to just share like, oh, it's gonna be like a little pen, or sometimes it's like I remember Gabby's first like blood draw, and I was just like, oh, we're just gonna go with this. Yeah, like, yeah. How do I explain? Oh, you're gonna have a needle in your arm taking blood out. You're like, close your eyes and squeeze my arm. Look, I'll hold you real tight. Yeah, hold you real tight so that you don't injure yourself when they do this. Okay, cool. Yeah, no, I think like to your point too, like we once upon a time in our early days did not require like pre-op. And we see such a big difference between the kids and adults who get the preoperative myofunctional therapy or feeding therapy or whatever therapy it is to prep the tissue, plus body work is always beneficial too. Because like when you have all these tension patterns in the orofacial complex, it carries to other parts of the body, right? It's all interconnected. There's all these compensations happening. And so we see the best results with anybody who is taking that team approach, right? Like they're working with you, the dentist, they're working with us for the myo or the feeding or the combination. Then we've got the family as part of that team too. And then any other providers who might be involved. But I think what's really important is to have the parents like go in if they're going to have to do active wound care. Like let's say there's no sutures, they're going to have to be elevating that tongue however many times a day. You know, we need them feeling so dang good about it when they go to the release appointment. Like they're not seeing it for the first time, trying it for the first time, because I can tell you like 99% of those parents are either not going to do it well, or they're not going to do it at all because they're too scared and they don't want to hurt their child, and they're not feeling prepped. They're anxious and they're like, you know what, we'll just go back to the dentist in a week and they can just do whatever they need to do. You know what I mean? So like we like to be like, okay, mom, or okay, dad, okay, caregiver, like how are you feeling? Like what like show me. And I used to have them do it on me. I'd be like, do it on me. I want to feel that like, what you're doing. And that way I can say, okay, go a little harder. No, like you're not going to hurt me.
Yeah.
You know what I mean? And so that way I feel like the parents feel like really like ready and like they're ready to go. They feel good. So then the kid feels good. Like
even going back to what you said about like the Play-Doh, like make a model, have them practice. They can see how hard.
Totally.
I mean, because sometimes when you learn how to suture, you're like doing it on like a tomato where this skin is very thin. Like those just different ways to bring the message home. Is great.
Yeah. And then like even the kid, depending on their age, like having them do it on the parent and then the parent do it on them. Yeah. So it's sort of just like if you get a kid, sometimes there's kids who are just like, whatever, do whatever you want. And then you get kids who are like, absolutely not. Yeah. Don't come near my face. This hurts. Right. Or this feels funny. So like we will sometimes tell kids, you know what? Your tongue's going to feel a little funny after. Sure. And so we're going to eat fun things. You're going to get like a popsicle and because we know the cold feels good and it's easy to swallow the liquid or just, we kind of have something fun for them to look forward to. Yeah. I mean, I remember like when I had my tongue tie released and I didn't have any sutures placed, but I went home that night and I ate, don't ask me why, but in my brain, I was like, this seems like a good idea. I ate oatmeal. Yeah. It took me 45 minutes to eat like a half a cup of oatmeal. It was ridiculous. I was like, okay, this was a horrible idea. Yeah. Clearly not the first meal I should have had. Yeah, yeah. But it was also a really good learning experience. And now I can tell parents.
I did this. Yeah. I went like out to dinner and have like a salad. I'm like, what am I doing? I can't eat this right now. Yeah.
I know. So funny.
But no, I mean, and also like pain management too. Like if, maybe there'll be a little pain, maybe not, just depending on like how restricted somebody is, but like being ahead of that. So like if you are into homeopathy, using some arnica, for example, before the procedure, like, and obviously the provider needs to look at the medical history, the dental history, talk about like significant medical conditions, any allergies, any current medications, supplements, all those things that are more than likely already discussed. But, a lot of times if you just get ahead of the pain management, or B, like sometimes if they're a little numb, whether it's like for this or filling or whatever it may be, when I do like my dental mission trips and the kids, like there's a language barrier and they don't understand, like I'll show them in my phone, like, look, everything looks normal, because it's a lot of times that funny feeling that it's like fat or swollen, but it's really, it looks fine. And then the kid will say, oh, okay.
Yeah. So. Yeah. No, I love that. I feel like it's that awareness, right? Yeah. You're being, and that body, just understanding what's happening to their body, because I think, again, it calms the nerves. Right. Like if you can just see that everything looks okay. Yeah. Okay. Cause like what you feel and what you see, right? Your senses are totally going to be so different until you marry them together. Yeah. So I love that. Yeah. And I think that kind of ties into like some of like the themes that I think go throughout the books, right? Like this whole concept of self-awareness that you brought up. Just understanding your body and understanding how to talk about these things once you're, once it's age appropriate. Sure. Overcoming like fear, right? Because I think some of these things can feel a little scary. And so I do feel like it's our job as a providers to help parents feel calm, like you said, because the kids are going to feed off of the parents' nervous system. And if the parents are calm, the kids will be calmer. So I think those things are so, so very important. I do feel like we did a really good job of kind of like, intertwining that throughout these books.
And it's cool everyone to see like my patients that have been getting them. Like I had one today and she's like, my like daughter who just had a baby, like is making, like the baby's making a sound during nursing. And I was like, you should use these books, like, because like whether it's a grandma with a mom who just had a baby and you're like trying not to like step on toe, whatever it may be. It's a very also like a gentle way just to like, hey, my dentist wrote these books. Yeah. Like, so it's very cool because it's parents, like you said, providers, like putting them in the waiting rooms, giving them to the kids. Like I brought it to Gabby's school, most school. It's so many people can use them. Grandma, it's great.
Yeah. And I think it also helps with like, because we're kind of showing collaboration in the books amongst providers. And I think that's important to demonstrate, because I know we talk about it a lot, but I don't think parents understand. Half the time parents come to me, they're like, well, who do I see first? And I don't think they understand that we can work together. Of course. Right. And sometimes if you go to the dentist first, or you go to the myotherapist first, or you go to the body worker first, like those of us who are actually collaborating, like we're going to send you to the next person that we believe is going to be the best for your case. And we're going to communicate with them. So I love that, like, we kind of naturally like worked that into the book.
And I think I want to just like have a moment of like appreciation for this like team approach to care, because when you and I first started doing this like a million years ago, there wasn't that. And like you and I had started like that study club where we were like each month reading like a cool, nerdy, like medical book or whatever, you know. But I feel like the other day or maybe like maybe a month ago at this point, I had a referral from a child psychiatrist.
Oh.
Because they had been talking to the parents about sleep. Because a lot of times is like going a little off topic, but sort of in all of this airway space, it's like children, if they're not sleeping well, and whether it's the tongue position or whatever, enlarged adenoids or whatever it may be, if they're not sleeping well, us adults, we compensate. Drink coffee, take a nap, whatever. Kids, it comes out as either like really tired or hyperactivity. And in other countries, like before you can even think about these like ADHD meds or anything like that, like kids are getting sleep studies or being airways being evaluated. That's not going on. I mean, and that needs to happen. Like here, in the US, we need to be talking about airway. And I think this is also a nice way to introduce some of that, because it's all part of the airway, your mouth, you need it to breathe, your nose, like all that. I mean, you're breathing to your nose, but you know what I mean in terms of like the mouth, you know, but it's all connected. And so I just wanted to take a moment of appreciation, thank all the providers that are treating as a team, because it's really, it's a great thing. It's beautiful. It's really helping so many people that maybe it didn't help before.
Yeah. Well, and I think the more that this happens, the earlier we find these kids, the earlier they get the help that they need so they can thrive.
Yes.
And you know, it's like there's already stuff going on. We don't need to wait for it to snowball to the point of it being like so the kid is so off kilter that like we're in like totally just, you know,
trying
survival
to
mode, right?
Versus like you know, it's one thing if you need to do some things to restore, you know, but like I feel like if you see these kids in their formative years, they're able to function so much better. Like it's all about function and obviously form, but form influences function and function influences form. Like all those things are intertwined. And I mean, I just feel like that's part of what this book brings into light is like, okay, what is the function right now? What is the form? You know, so. Yeah, thank you. I appreciate it. I love working with you and your team.
I know. It's so funny. It's like, who would have known when we were in like second grade together that this is where we would be right now? I love it. I love this for us.
Yeah. We should share the really picture of our kids, because the youngest, like going in second or whatever, like it's the generations. We're passing it on.
It's so cool. And it's really cool because it's like our kids are in appliances. We're practicing what we preach. Like, you know, they've early airway intervention and all the fun stuff. And, you know, I keep hearing from other providers who have purchased the books or that were at one of our book signings that like, they're like, I put it on the coffee table in my waiting room and like, like everyone's loving them. And so just a little plug, if you guys don't have the books yet, like go to Amazon. You can either type in Dr. Jennifer Tipograph or Hallie Bulkin. Either of our names will pull up the 3 books and put them on the table in your waiting rooms, share them with your families. You know, you can even use them in your therapy sessions if you want to, because I know some like SLPs, for example, will read books in their therapy sessions as part of the session and everything. And so these are really great. They're not heavily therapeutic. Like it's not going to require the kid to do a lot, but it'll be really playful and get the kid like we were talking about that, build that self-awareness and kind of figure out what's your tongue doing. So really good like introduction, I think, to that for young kids, especially. And then parents, like having these at home on your bookshelf is not a bad idea because the more the kids are talking about it, the cooler it becomes. And then like if it's your kid who needs expansion or braces, then it's like totally normalized and it's not the weird thing anymore. Like Lily came home and she's like, Mama, 2 girls in my class have braces and 1 boy got an expander, but it doesn't look like mine. And I was like, okay, you know, and like, it's just, she was excited about it because other kids were basically doing what she's doing and she wasn't alone in it. And it's like, I think we forget as parents that like, yes, you know, these expansion appliances can seem like a normal part of child development. But in the airway space, it's a little bit different than in your traditional like ortho approach. And so like while braces maybe become a little bit normalized, like my goal is for my kids to not need braces because of what we're doing. So let's normalize that conversation where the kids have expanders and Invisalign.
Absolutely. Yeah.
So I loved that when she came home. I was like, oh, this is cool. Because she's like looking at the kids and being like, oh, they're like me though. Like we have this similarity, which is very, very cool. So, all right. So let's start to wrap this up a little bit. People have asked like, are you going to write more books? Are there other topics? And I'm like, oh my gosh, we literally just launched these. Yeah. But I know you and I were talking, we're like, there's so many different things we could potentially talk
even
about.
Talking to you right now, I'm like, oh, I have another idea.
I know. I was sitting here and I was like, infant.
Yes.
Okay. Infant symptoms. Yes. That's not covered in this book.
Yeah.
I know we'll chat, but we shared where to find them. And listen, I mean, we'd love to hear from you. So if you have your own journey and a tongue journey or whatever for your child or you can always reach out to, either one of us. Jen, tell them where they can find you on Instagram.
So I work at a practice. It's called Natural Dentist Associates. On Instagram, I'm at Dr. Dr. Jennifer Tipograph. And then, if you want to just go online and check out the practice or you have any questions, you can just message me. I'm happy to chat. I love this stuff. So happy to talk anytime. Thank you.
Awesome. And we'll put that all in the show notes too, so they can easily click through to the practice and to the Instagrams and everything. Let me think if there's anything else. Any last thoughts before we start to wrap up?
There's so many things I want to talk about, but it's just, keep smiling, it's brush your teeth, all that fun stuff. We don't want to forget about those little things, but talking about like the pH changes. And then I think one thing I feel like in the past, I'm like, here's my PSA, no extraction of adult teeth.
Yes.
One of those, I mean, obviously like the wisdom teeth, the third molars, even though the research now shows if you have room for them, they're not infected, impacted, or decayed to keep them. But unfortunately, I'm still seeing people being, recommended for premolar extractions to create more space. There's other ways to do it now.
Yeah.
So I feel like that's like my PSA.
Yeah, because as an adult, I'm over here going like, I had my wisdom teeth out. I had 2 that were impacted, 2 that weren't. They pulled all 4 when I was in high school. Yeah. And I feel like I've spent like half my adult life trying to open my airway through expansion. Yes. Because, which would have been easier had I still had those 4 teeth there. However, here we are. So on that token, because I feel like parents may ask, and I just had a conversation with a friend yesterday, like leaving Pilates. Yeah. Her son had I guess one of his molars, pulled out. It's a baby tooth though, because it was causing pain. They said there was a tooth that was like kind of growing in sideways or something. And the kid's like 5. So they ended up pulling the tooth out. Now the child is going for expansion to a recommended provider like soon. So that's not the provider they saw, but I was like, okay, the child will be okay. But you mentioned like adult, like permanent teeth. Now, do you have thoughts on like pulling baby teeth?
So it depends. I mean, obviously if it's like the baby tooth is infected or something's going on where like you can't save it, like by all means, you have to do what you need to do. And like, but you want to maintain that space. So ideally, if they're going to do growth appliance therapy or expansion, whatever you want to call it, ideally that will be able to hold the space. Because back in the day, it was like, oh, space maintainers. But for some of my patients that I'm doing an expander on, it will help to maintain that space. So the last thing you want is for that space to close and then block the permanent tooth from coming in.
Yes. Yeah. Okay. Beautiful. Yeah. Love that. Thank you. It just was like, it randomly popped into my brain and I was like, this is interesting. Yeah. And then one last thing, like to your point too. So you had mentioned that like your tongue is your natural palate expander. And if we can get that tongue up in the roof of the mouth, like whether it's not up there now, but you get expanded and then myo and you learn to have the tongue up there, like it will hold your expansion. I wanted to highlight that because I feel like I was an adult, like ortho relapse case. I've had so many other adults I've worked with that have had orthodontic relapse, meaning that like everything kind of collapsed back after having expansion or braces because the tongue was either pushing up against the teeth, through the teeth, or was sitting low in the mouth. It was not actually like living on the roof of the mouth, holding that new beautiful U-shaped wide palate, right?
Right.
And so that's like, I always like to highlight that for people because a lot of people are like, oh, well, I was expanded when I was a kid. And I'm looking at their mouth and I'm like, but you look pretty high and narrow to me. And you're saying you've got all these symptoms. So I know this is a kid series, guys, but like this applies across the lifespan. So that I just wanted to plug that.
Yeah. Thank you. Yeah.
Yeah. Well, thank you so much for hanging out today. I'm excited to get these books just out there in the world more. And who knows, we'll have to see if we come out with any others.
Thank you.
Thanks for listening to this podcast. If you found value in this episode and want to hear more of these MyoTots airway and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBulkin.com or pop over to @HallieBulkin on Instagram to get all the latest updates.